Welcome back, future orthodontists. Today we discuss increased overjet, one of the most common malocclusions. Increased overjet is the horizontal distance between upper and lower incisors exceeding the normal range, typically more than 2 to 3 millimeters. Remember the mnemonic HDI, horizontal distance, deviated incisors. Causes of increased overjet include skeletal class 2 relationship, dental protrusion, habits such as thumb sucking or tongue thrusting, early loss of primary teeth, and genetic factors. Use the mnemonic SDHEG, skeletal, dental, habits, early loss, genetics. Identifying the cause is essential for treatment planning. Clinical features include protrusive upper incisors, increased visibility of upper teeth, lip incompetence, and risk of trauma to protruded teeth. Mnemonic PVLT. Protrusive, visibility, lip incompetence, trauma. Management depends on age, severity, and skeletal versus dental origin. Growth modification with functional appliances is recommended in growing patients. Orthodontic camouflage with extractions and braces is used in mild cases. Orthognathic surgery may be needed for severe skeletal class 2 cases in adults. Mnemonic GSC. Growth modification, camouflage, surgery. Early diagnosis and intervention improve aesthetics and function. To summarize, increased overjet essentials are definition, HDI, horizontal distance, deviated, incisors, etiology, SDHEG, skeletal, dental, habits, early loss, genetics, clinical features, PVLT, protrusive, visibility, lip incompetence, trauma, management, GSC, growth modification, camouflage, surgery. Quiz time. Question 1. What does HDI stand for? Question 2. Which is not a common cause? Question 3. Key clinical features include what? Question 4. Management options mnemonic. Excellent. You now understand increased overjet, its causes, features, and management strategies. Next video, increased overbite.